How to fix puffiness under eyes and drooping eyelids, especially left side. I would like to take care of the puffiness under my eyes and droopy eyelids with minimum invasiveness and minimum cost. The puffiness I have had since I was 15. I am now 50. How much would this cost? Please describe the most natural procedure. Thank you.
Thank you for your question. You've submitted several photos and you state in your question that you've had these bags under your eyes since you were 15, you're now 50, and you want to do the procedure with minimal invasiveness and minimal cost. And you want to get some guidance on how to achieve the most natural look. Well, I can certainly give you some guidance in how we do what we do in our practice. I'm a board-certified cosmetic surgeon certified by the American Board of Cosmetic Surgery and a fellowship-trained oculofacial plastic and reconstructive surgeon through the American Society of Ophthalmic Plastic and Reconstructive Surgery. And I've been in practice for over 20 years in Manhattan and in Long Island. Under eye bags is one of the most common issues we deal with, and thanks to unfortunately a lot of celebrities with undesirable looks from the opinions of most people, as well as a lot of observations of very plastic-looking people walking around the malls and streets of New York, that people are really focusing on the word natural. And I think that as the cosmetic field becomes more and more accessible, and the knowledge and the information becomes more accessible, so too the unfortunate negative associations with cosmetic surgery, which of course make people want to avoid any type of procedure that makes them look less natural. So let's define what natural means, and I'll tell you how we would approach someone like yourself. When I talk to patients about looking natural, especially with under-eye bags, I tell them that essentially you want to look as if you never had the bags. You know, the bags under eyes can make someone look so much older, so tired. And no matter what age you're at, and we've operated on people as young as 14, or at least in their 20s, and as old as in the later decades, 80s and 90s. So clearly there is always an age-related association, but more of this is a genetic issue. So and the puffiness is something called lower eyelid fat prolapse. That means the fat that's normally around the eyes pushes forward, creates this bulge. It's often referred to as herniated fat. Now, in order to achieve a natural look, what are some of the things we want to retain and what are the things we want to avoid? Well, we want to retain the true shape of the eyes. You know, one of the things that happens after people have cosmetic eyelid surgery, particularly lower eyelid surgery, is from what I've seen other people do, is to get a lot of rounding of the eyes. The lower eyelids get pulled down and they become retracted. And in fact, people come to us from all over the world for repair of lower eyelid retraction. We have had patients from almost every continent who have come here because their eyelids were pulled down or they just ended up with a shape they didn't like. That rounded shape may look like something some people like, but for most people, the character of the eye shape is something that goes together with the character of their face and their personality. And when that shape is taken away, it's very distressing. Now, that being said, what I do typically is I work from the inside of the eyelid and I preserve the muscles necessary to retain that shape. And so it's called a transconjunctival blepharoplasty. In many ways, that can be considered minimally invasive. Now, the other side of this equation is, of course, skin. Is there extra skin? Usually there is not. But is there an opportunity to help with skin quality? Usually there is. And skin quality is something we've become very good at helping people with, of all skin types. But routinely, for people with lighter skin, I would do a combination of a laser procedure, such as a fractional CO2 laser and use something called platelet-rich plasma, which is derived from your own blood and contains the growth factors and the healing factors that stimulate skin quality. And it's been very successful for us in our practice. So you combine these three modalities: address the fat pockets from the inside, minimally invasive, and address the skin quality by using laser and platelet-rich plasma, and you've got a very nice impact on your overall appearance. And the fascinating thing is people are not going to usually notice. What they'll say is that you look really good, you look like you changed your hair. You know, it looks very natural, and to me that's the definition of natural. I've written a book about this, and I'm constantly speaking when I lecture in both professional meetings and to consumers or patients about this, and it really is, there's a certain style, and that's very important. I always stress that there has to be an artistry. You know, nature and the way we look at people, there's a certain ratios and certain balance that's so important. And when it looks natural, it's almost, you can't perceive it. But when it looks obvious, that's when you look at someone and say, hey, you have nice, you had surgery, and that's not what you want. So with that being said, as far as cost is concerned, understand that cost has to be based on value. You want quality. You do not want to save money when it comes to risk, a high-risk procedure in terms of your health and your eyes. So you want to get value. So in our practice, to address that cost concern, we have our own facilities. They're all certified by the Joint Commission. We have operating rooms in both offices, and we're able to address some of those concerns, but we never, cut corners. There's the surgeon's fee, anesthesia, and facility, and it's very important that to maintain quality, you do invest what is the best value for you, but don't just always use cost as your guideline, because it's really unheard of getting something very cheap and getting something really great when it comes to medical services. It just doesn't work that way. So I hope that was helpful. I wish you the best of luck, and thank you for your question.